Thanks for tuning in. This presentation is a courtesy of Senior American Insurance Agency to anyone who's aging into the government health insurance program known as Medicare. At this point, many of you have received our informational packages or maybe downloaded the reports that we've offered. The reports being the basics or the ABCDs of Medicare, the enrollment calendar, the things that you should do prior to enrolling in a Medicare plan, and finally the employer coordination report. I hope that these reports have jump-started your understanding of Medicare and the options that you have as a new Medicare enrollee. If you've not received the reports, please make a note of the phone number on the screen and we'll make sure to get those reports to you as soon as possible. Again, Senior American Insurance Agency is who we are, and we've been guiding seniors through the Medicare system for over 30 years. And with the experts on our staff, we have over 70 years worth of experience. Helping seniors is our only business. My name is Dan, my picture here on the screen. I hope to empower you as a new Medicare enrollee to make the best decisions for your individual health care needs, your lifestyle, and your budget. Our goal is to be the #1 service agency for new Medicare enrollees. You know, over the next few years, there's something like 2,000 people a day that are turning 65 and starting on Medicare. And we can accomplish our goal by providing pertinent, accurate, updated information that the new enrollees need to make smart decisions on their Medicare. In addition to our already outstanding customer service, isn't it refreshing to have someone actually pick up the phone and answer it? No push-button menus, no call centers from foreign countries. We know that everybody's situation is going to be different. We know that everybody's timing schedule is different, their learning curves are different, so we try to make it manageable with public online webinars as well as one-on-one consultations for all of those that I'm sure have special circumstances. We provide high quality companies and products. Some of the companies that we deal with right now are United Healthcare, which is number 19 or 20 on the Fortune 500 list. Everybody's heard of Mutual in Omaha. These large companies have the adequate resources to make sure that your medical bills would get paid. We also want to be a resource for other senior needs. People turn to us again and again for other needs, final expense plans, long-term care programs, estate planning, and estate trust advice. But for now, our focus is going to be on Medicare. So sit back, grab a pencil and paper to jot down any questions that you might have. There'll be ample time in the future for contact through telephone, webinars, or emails. I think we're going to start by just reviewing the things that we've done in the past and the information you've already viewed. Okay, Medicare Basics. We've already looked at the fact that there's 4 primary components that make up the Medicare system. Part A, which is generally considered the hospital portion of Medicare. Part B, the medical portion of Medicare. Part C is also known as Medicare Advantage. Those two terms are synonymous. Part D, of course, is the prescription drug component of Medicare. So those are the 4 basic parts of Medicare, and we will break each one of these down individually in detail coming up just here in a moment. Okay, we'll start with Part A Medicare. Part A Medicare, as we discussed, is the hospital coverage portion of Medicare. Part A Medicare is almost always as an inpatient. There can be inpatient in hospitalization, which could either be intensive care or general hospitalization. You could be an inpatient in a skilled nursing facility. That's where you're receiving some type of rehabilitation and you're actually confined there. You're staying in a skilled nursing facility. Inpatient mental health is also obviously an inpatient receiving mental health treatments. There are a couple of other items that are billed to Part A Medicare that would not necessarily be as an inpatient. Obviously, home care is care in your home, so that wouldn't be as an inpatient. Hospice is almost always given in your home as well. And there are some blood transfusions that are billed to Part A Medicare. But when you think of Part A Medicare in general, it's as an inpatient in either a hospital or a skilled nursing facility. Now we'll look at Part B, the medical insurance portion of Medicare. And Part B Medicare is generally considered to be the broadest category of Medicare because there are so many items that are billed under Part B. So anything that's really considered as an outpatient service, the most fundamental, of course, being a doctor's visit or a test like an EKG, an MRI, a sonogram, and those type of things. Procedures and outpatient surgeries. These are items that could actually be given to you in a hospital facility, but you're not actually admitted there. You receive the procedure or the surgery and then you come home without being admitted. It's still billed to Part B as an outpatient service. Ambulance services, medical equipment today is a huge category. Wheelchairs, walkers, oxygen machines, diabetic supplies, even things like braces and artificial limbs and eyes. All those things are billed as medical equipment, durable medical equipment. Clinical lab services, anytime there's a blood panel and lab work, that's billed in there. Physical therapy, and even some preventative items like flu shots and pneumonia vaccines. So essentially any service that's provided where you're not an inpatient, but any service that's provided on an outpatient basis under Medicare. Next, we'll look at Part C. Part C, as we said, is also known as Medicare Advantage. Part C plans are actually private insurance companies that are doing administration for the federal government. They're doing administration for the Part A hospital parts of Medicare, the Part B medical portions of Medicare, and in many instances also the Part D drug plans built in. There are four fundamental formats in which these Part C Medicare Advantage plans are operated. The first being an HMO, or a health maintenance organization. Health maintenance organizations typically have contracted doctors and hospitals, and they ask you to go to those doctors and hospitals. If you receive services outside of the HMO, outside of those contracted doctors and hospitals, then you might be responsible for the cost of those services yourself if you didn't have prior permission from the HMO or the health plan. You might have to get a referral to go to a specialist, and there might be other certain restrictions like pre-authorizations for tests. So HMOs are typically understood to be the most strict type of Medicare Advantage plan with the most rules and regulations. The next is a PPO, or a preferred provider organization. Preferred provider organizations work similar to an HMO in the fact that they usually do have contracted doctors and hospitals, and usually in a PPO they ask you to use those doctors and hospitals if you want to pay the lower prices. If you receive services outside, you can generally go to any other doctor or hospital as long as that doctor or hospital is willing to bill your PPO plan as an out-of-network provider, and of course you would pay more for the services that you receive out of network than the services that you received in network, but at least it gives you the opportunity to go to those out of network providers. Private fee-for-service plans. Typically, with a private fee-for-service plan, you can go to any doctor and any hospital in the United States as long as that doctor and hospital is willing to accept the plan's terms and conditions. What that basically means is they know that up front they're going to get paid the Medicare scale. So private fee-for-service plans, in other words, are kind of piggybacking on the Medicare contract that already exists with the doctors and hospitals that you go to. So they're using the actual contract of Medicare, but they're billing it through the private fee-for-service plan. So again, any doctor in any hospital, as long as they agree to accept the plan's terms and conditions. Special needs plans are usually plans that have some type of enrollment criteria. You do have to meet some type of a criteria to get enrolled. The most common ones that come to mind are people that have Medicare and state medical assistance, also known as Medicaid. There are also plans that are specifically for people with chronic health conditions like diabetes and heart disease. But they do have specific enrollment criteria, and we will break and go into a little bit more detail about Medicare Part C plans. The things you need to know is they're private companies that are doing the administration, and there are four typical formats in which they're operated. Part D prescription drug plans were instituted in 2006, obviously to cover the growing cost of prescription drugs. Part D plans really need to have their whole section of their own because it's such a large topic, and we will expound on that in another Part D segment that's expounded into all the different aspects of Part D. In this particular case, we're going to keep it a little bit shorter and just go over the general idea of Part D, obviously to help cover the cost of drugs. Part D plans are also administered by private insurance companies. Part D plans can be all by themselves in a standalone Part D plan or PDP, or they can be as instituted inside of a Part C Medicare Advantage plan that also has doctor and hospital benefits. So you can get it either way, standalone or included in a Part C plan. Anybody that's on Medicare Part A or Part B is eligible. If you don't join a Part D plan when you're first eligible, you might have to pay late enrollment penalties down the road. Those would be assessed if you don't have anything that's called creditable coverage, which means it's equal to or greater than another Part D prescription drug plan. And the famous donut hole, everybody's heard that term. The donut hole, essentially all Part D plans do have some type of a limit throughout the year, and once you've exceeded that limit, you're in what they call the donut hole, which is a lack of coverage. Once you pay so much out of pocket, these numbers change year to year, then you can get into what they call the catastrophic coverage of the Part D plan, where it will again start covering the cost of the drugs, but during that time in the middle there can be no coverage, and that's why they call it a donut hole, because it's a lack of coverage inside and outside of other coverages. So that right there is just a very quick brief overview of Part D. Again, you can look at our Part D expounded segment to get the full story on the Part D. This resource is being made available to you by Senior American Insurance Agency so that you can have an understanding of the basics of Medicare. Now that you have an understanding of the basics, we urge you to continue with our educational video series to further your education so that you can make wise Medicare decisions for yourself and your family. If you get stuck, don't worry, we're available from 8 a.m. to 3:30 Eastern Standard every business day by phone. Just give us a call, 800-332-7557. We can assign a health coach to help you through the decision-making process. Everybody's going to have individual circumstances that will not be addressed in this type of a format. We have educational webinars that are designed for you to look at specific products, Medicare Advantage products, Medicare Supplement products. Look for ways on our website to join those webinars. We can even do a one-on-one webinar. We can give you a quote once you are to the point where you're making decisions about specific products. We can give you a quote using your state, county, and zip code information, and you can always email us at help@65medicareinfo.com. Thanks for tuning in today. Give us a call if you have any questions or if you want a specific quote.